While my slides come up, I will just thank the organizers for the invitation for coming to speak with you today. So, I have been asked to talk about the thorny issue of intellectual property because I'm an intellectual property lawyer. And so I will be delving into this a little bit more deeply. But first of all, I just want to keep an eye on where we're going and why we're here. And that is to translate good science into the clinic for the benefit of society and for the benefit of patients. And I don't need to repeat this, really, because the previous speakers have indicated that the only way that we're going to move science into the clinic is through highly collaborative, multinational, multidisciplinary, multisectorial research. Now, the problem is I work in a few fairly complex fields. These are stem cells. I do most of my research in the stem cell space. And one of the issues with stem cell research is that the more we know, the less we know. These are incredibly complex systems that are going to behave in incredibly complex ways as we move them into patients. And so, in a sense, some of this research needs to be incubated in academia, probably longer than is usual for drug therapies. So we need to just keep that in mind. We're just talking about the global nature of translational environments. This is a fairly detailed analysis that we've done of over 4,000 clinical trials in the stem cell space. And so it's important to remember that we're not just talking about North America and Europe here. We're really talking about an interconnected global network. This is an indication of the blue in the circles are hematopoietic stem cell clinical trials, things that we've been doing. This is bone marrow therapies that we've been doing for 50 years or so. The red is what we can really consider to be the regenerative medicine space, the novel things that we're hoping for stem cells to be able to do. And you can see that a lot of that research using things like mesenchymal stem cells are happening in Asia, in the Middle East, in countries outside of Europe and North America. So that just makes things even more complicated. We have representatives of the key actors that we're trying to bring together in collaborative networks here, from academia, their institutions, the legal entities within their institutions that manage intellectual property, whether they're tech transfer offices or industry liaison officers, the funders who have enormous sticks to drive incentives to pulling the collaborations together, biotech, pharma, regulators, health systems, and publics and patients, the latter being, I think, the most important part of the equation. So when we're talking about the pre-competitive environment that's been raised, that the public-private partnership model is really built to drive forward, we're talking about knowledge management and moving knowledge or raising the level of knowledge for the benefit of all of the R&D actors within that space. And the way to manage it is to try to manage the intellectual property inputs, the intellectual property outputs, and to try to create an environment where the innovation within the pre-competitive space is managed to maximize sharing without necessarily impacting on the ability to appropriate or privatize knowledge or innovations that are closer to practical applications. And this is a very, very fine line to walk. It's very difficult to define that pre-competitive space because what is pre-competitive for some actors may not be pre-competitive for others. And here, specifically, you would be talking about the tensions particularly relevant to small biotech and small biotech sectors. Again, in order to move this forward, we need to manage the infrastructure that is required for the reagents, the data, the biomaterials that are required for the kinds of research within the pre-competitive space. So these are the databases, the biorepositories, the biobanks, and particularly in the stem cell environment, more importantly now, are models for aggregating ability and infrastructure around GMP facilities, so good manufacturing practice facilities. So what are the models? This is based on a paper that we have published in Science Translational Medicine. It's a couple of years now. This is a new world. Really, this kind of thinking and these kinds of models have been evolving over the last decade. The actual kind of outcomes measures are still a little bit out. It makes sense. Collaborative models make sense. Theoretically, these should be driving forward the goals or the outcomes that we're looking for in terms of moving things into the clinic or diagnostics and medicines into the clinic. But we still need a lot more information to see which of these models works best under which circumstances. So common pool resources would be some of the ways that we're sharing biomaterials and data within biorepositories. There's open source models. These are models that are more common around software. There's open access models where you're creating a collaborative culture for sharing of information and data and biomaterials within consortia. Clearinghouses for information, patent pools. These are sort of fairly well developed within high-tech sectors. Research alliances, this is more industry kinds of alliances. And then, of course, the public-private partnerships that we're talking about today. So all of these things are very exciting. Can you move the next slide forward, please? This button doesn't seem to be... Can you move the next slide forward, please? There we go. All right, so then the thorny issue of intellectual property within here. When we're talking about managing intellectual property, we're not just talking about the intellectual property that's generated by these consortia or public-private partnerships. We're also talking about the pre-existing background intellectual property. So the point that was made before, the kinds of ownership structures for managing the intellectual property need to be extremely clear and transparent up front. And the more actors and the more international and the more multinational things get, the more complicated things get. So when we're talking about contractual agreements, this is basically the kinds of agreements in terms of research contracts, collaborative research agreements, and then the more sort of specific agreements around moving materials and biomaterials around. We really are talking about building trust relationships among the actors so that they know what is going to happen with the research that is being done and their rights during the length of the project and their rights to any intellectual property that might be generated that is closer towards practical outcomes and innovation that can actually be monetized. And so the problem with the more international that research relationships get is that you start to end up with conflicts in terms of contracting cultures. And the contracting cultures within civil law jurisdictions within Europe are quite different to those in common law jurisdictions in North America. And so, again, things just get more complicated the greater the number of actors that you have involved and the more international things get. So some of the best practices. I think what needs to be done in terms of contracting relationships is this keeping an eye on the prize, understanding the nature of the relationship and the goals. This should be written into a clear preamble so that all of the other provisions within the relationship are judged as against what the actual outcome or the result of the project is supposed to be. Contracting agreements can get very, very complicated very, very quickly, especially as multiple institutional lawyers get their hands on it. Everybody wants to add their bit. This is where things go back and forth. And really, at that point, institutional lawyers have an incredible ability to clog up the works and delay the negotiations and delay the relationships. And so here, really, again, keeping the eye on the goal of the project, keep things as simple as possible. And being a lawyer, that can get very, very difficult. But trying to keep things simple is a very good... so if you don't need an MTA, don't do an MTA. Just do simple conditions of use, for example. It needs to be based on a realistic assessment of the value of the intellectual property that's being generated. Is this pre-competitive, or is this closer to practical outcome? Most intellectual property is of no value. Most patents are valueless and worthless. And so at that point, it is not worth haggling over things that at the end of the day are research tools that are not going to drive things closer to practical outcome. So keeping an eye on the actual value of the intellectual property is very important. In terms of biorepositories, one of the big thorny issues, and this is a real difference in contracting culture between North America and Europe, is this issue of dissemination or sharing and value generation for commercial versus non-commercial use. I can answer questions about that a little bit later. It's important for academic institutions and for public-private partnerships to retain rights for developing or for further research using the intellectual property that they're generating within their research consortia. However, that should be limited to the value generation of the intellectual property within the consortium. It should not extend to reach-through rights to other partners or to innovation that is existing outside of the consortium. And I can give you an actual example of where that is. No reach-through, that's a best practice for industry, but it's also a best practice for public sector organizations. The intellectual property contracts should be limited to the intellectual property being generated within the project. And then finally, we've heard a little bit about incentives. If you want to drive public-private partnerships forward and you want to move these forward and you want to manage intellectual property in more creative ways in order to keep knowledge flowing and knowledge shared within a pre-competitive environment, adding the intellectual property to intellectual property that may actually be of value as we drive closer towards clinical application, the incentive structures need to change. And things like the public-private partnerships are driving this model forward. They are exemplars. This is the way that things should be done. The NIH has been very proactive about this. IMI is very proactive about this. But it comes back to incentives and culture. Incentives are a very strong way to influence behavior. And if you measure the wrong things, you incentivize the wrong behaviors. So if all your incentives are about is counting things, so number of patents, remember that lots of individual decisions to patent can in fact have a systemic effect of cluttering up the intellectual property environment. If you want to move those incentives forwards, you need to measure other things than simple counts of stuff. And so I was really pleased to see your network graph that you were showing. Here you need to start to incentivize things about actual products to market, actual influences on the regulatory environment, actual influences on methods and diagnostics, and the recognition that multi-sectoral, and collaborative research is important, and measuring the actual network effects and the value added of public-private partnerships. So I just have a few things that are willing to share. These are things that we've written in this environment. And finally, I'll just acknowledge the funders of my work. Thank you very much.